Parathyroid cancer is an oncological disease. Look at this picture, shows that parathyroid glands, ultrasound findings. Look at this. PET scan for metastasis. Then MRI scan findings. Look at this. A detail going on. Introduction. Parathyroid gland is a rare and aggressive malignancy of the parathyroid glands. The small endocrine glands located behind the thyroid play a crucial role in calcium homeostasis by secreting parathyroid hormone PTH. Parathyroid cancer often lead to excessive production of PTH, causing severe hypercalcemia, which can result in significant morbidity and mortality. Early diagnosis and management are critical to improving patients' outcomes. A definition. Parathyroid cancer is a malignant tumor arising from the parathyroid glands, characterized by uncontrolled growth of parathyroid cells that often produce excessive amounts of PTH, leading to hypercalcemia and its associated complications. Etymology. The term parathyroid originates from the Greek word para, beside, and thyroids, seals, referring to the gland's position near the thyroid. Cancer comes from the Latin cancer crop and Greek karikunos, describing the disease's invasive nature, similar to Grob's grace. Types. Parathyroid tumor can be classified into 1. Benign adenomas, non-cancerous growths that cause primary hyperparathyroidism. 2. Parathyroid hyperplasia, enlargement of multiple parathyroid glands. 3. Parathyroid carcinoma, a rare but malignant tumor that produces excessive PTH. Causes. The exact cause of parathyroid cancer is unknown, but several factors may contribute to, including 1. Genetic mutations, example CDC 73 gene mutations. 2. Exposure to radiation. 3. Prior to neck surgery. 4. Chronic kidney disease. 5. Familial history of endocrine disorders. Risk factors. 1. Genetic predisposition. Example hyperparathyroidism, jaw tumor syndrome. 2. Long standing primary hyperparathyroidism. 3. Exposure to ionizing radiation. 4. Male gender, slightly more common in men. 5. Middle aged individuals, typically 40 to 60 years of old. Complications. Parathyroid cancer can lead to various complications including 1. Severe hypercalcemia, 2. Renal stenosis and kidney failure, 3. Osteoporosis and fractures, 4. Cardiovascular complications, 5. Neuromuscular symptoms, 6. Metastasis to lung, liver or bones in advanced stages. Pathophysiology. Parathyroid cancer arises from malignant transformation of parathyroid cells. These tumors cells produce excessive PTH, leading to an increase in serum calcium levels. The persistent hypercalcemia disturbs normal physiological functions, affecting bones, kidneys, and neuromuscular activity. In aggressive cases, tumor inversion into surrounding tissues and metastasis can occur. Pathophysiology of parathyroid cancer step by step process. First step, genetic mutations and oncogenesis. Mutations in tumor suppressor genes, example CDC73, HRPT2, leads to uncontrolled cell proliferation, loss of parafibrobin, a protein that regulates cell growth, contributes to malignancy. 2. Unregulated parathyroid hormone PTH secretion. Cancerous parathyroid cells overproduce PTH, leading to primary hyperparathyroidism. Excessive PTH stimulate bone reabsorption, increasing calcium release into the bloodstream. 3. Hypercalcemia development. Persistent high PTH levels result in severe hypercalcemia, causing symptoms like weakness, kidney stone, and neuropsychiatric disturbances. Calcium reabsorption in the kidneys increases, leading to nephrocalcinosis and kidney dysfunction. 4. Tissue invasion and local spread. Malignant parathyroid cells invade surrounding structure, thyroid, trachea, esophagus, recurrent, laryngeal nerves. Local inversion can cause hoarseness, difficulty swallowing, and breathing issues. 5. Distinct metastasis, advanced stages. Metastasis to lung, liver, bone occurs in late stages, worsening hypercalcemia and systemic effects. Skeletal metastasis exacerbate bone pain and fractures. 6. Systemic complications and organ failure. Prolonged hypercalcemia can cause cardiac arrhythmias, pancreatitis, and neurological impairment. Multi-organ dysfunction may lead to life-threatening complications if untreated. This stepwise progression underscores the aggressive nature of parathyroid cancer and the importance of early detection. Signs and symptoms. 1. Skeletal symptoms, bone pain, pathological fractures, osteoporosis. 2. Renal symptoms, kidney stones, polyuria, nephrocalcinosis. 3. Neuromuscular symptoms, fatigue, muscle weakness, depression, confusion. 4. Gastrointestinal symptoms, nausea, vomiting, constipation, abdominal pain. 5. Cardiovascular symptoms, hypertension, arrhythmias. 6. Neck mass, a palpable lump in the neck. Rare but possible. Diagnosis. A. Laboratory test. 1. Elevated serum calcium levels. 2. High parathyroid hormone levels. B. Imaging studies. 1. Ultrasound of the neck. 2. Cystoscopy scan. 3. CT scan MRI. 4. PET scan for metastasis. C. Biopsy. Fine needle aspiration is often avoided due to risk of tumor seeding. D. Genetic testing. CDC73 gene mutation analysis. Nursing diagnosis. 1. Risk for electrolyte imbalance related to hypercalcemia. 2. Acute pain related to bone demineralization. 3. Risk for injury related to bone fragility. 4. Impair urinary elimination related to kidney stones. 5. Anxiety related to cancer diagnosis. Medical management. 1. Surgical removal. Parathyroidectomy. Primary treatment for parathyroid cancer. 2. Medications. Bisphosphonitis to lower calcium levels. Calcimimetics to reduce PTH secretion. Intravenous fluids and diuretics for acute hypercalcemia. 3. Radiation therapy. Chemotherapy used in metastatic cases. Nursing management. 1. Monitor serum calcium and PTH level regularly. 2. Provide hydration to prevent kidney stones. 3. Educate patients on recognizing hypercalcemia symptoms. 4. Pain management with prescribed analgesics. 5. Encourage mobility to prevent bone loss. Treatment options. 1. Surgery, parathyroidectomy, removal of the affected gland. 2. Radiotherapy for residual or recurrent tumors. 3. Chemotherapy, limited effectiveness, used in advanced cases. 4. Targeted therapy, synacalid to control PTH secretion. 5. Palliative care for advanced metastatic disease. Psychosocial medicine. 1. Counseling and support groups to help patients cope with diagnosis. 2. Stress management techniques, meditation, yoga, relaxation therapy. 3. Family education, providing information about disease and care. 4. Nutritional counseling, guidance on calcium and vitamin D intake. 5. Psychological therapy, cognitive behavioral therapy to manage anxiety and depression. Prevention. 1. Regular monitoring of calcium levels in high risk individuals. 2. Genetic screening for hereditary symptoms. 3. Avoidance of unnecessary radiation exposure. 4. Healthy lifestyle with balanced nutrition and exercise. 5. Early detection and management of primary hyperparathyroidism. In conclusion, parathyroid cancer is a rare but serious condition that requires early diagnosis and prompt treatment to prevent severe complications. Surgical removal remains the cornerstone of treatment, supported by medical management for hypercalcemia. Nurses play a crucial role in monitoring, educating, and supporting patients through their treatment journey. Awareness and early intervention can significantly improve patient outcomes and quality of life. Thank you. Have a nice day.